Hello and greetings to my respective audiences. I'm going to present in this conference about predictors and prevalence of tobacco smoking during COVID-19 among university students. Here, the first author is Ms. Ananya Nandy, ma'am, and I'm ADITI, the second author. We know tobacco consumption is one of the world's most critical health challenges and is killing more than 8 million people each year. And it is also directly responsible for about 7 million different fatalities. Cigarettes are deemed to be demerit goods. Now, this means that the use of these goods influences both the consumer and the third party. Consumption of cigarettes results not only in the rise in healthcare expenditures as well as in non-consumer passive smoking-related diseases. We know that the increase in the cost of tobacco products through tax implementation is not only a better way to minimize tobacco consumption, but also to improve public health. World Health Organization accepted this as a best-by strategy to prevent and control non-communicable diseases. Bangladesh is one of the high-achieving countries recognized for its various tobacco control measures like taxes on tobacco products, different mass media promotions, anti-smoking mass media promotions, and healthcare warning labels. Tobacco is a renowned risk for variable for several diseases, and it is a potential target for coronavirus. Every year on May 31st, we observe World No Tobacco Day. It focuses on empowering 100 million tobacco users to quit smoking efficiently. In this study, we would like to focus on whether the students are aware of the adverse effects of smoking during the COVID-19 outbreak and still resort to tobacco consumption or not. The questions to be covered in this study are: what are the important predictors of tobacco smoking? If the students are aware of the hazardous impact it has on their health, the kind of health issues they faced while consuming or after consuming tobacco. If students are aware of the consequences of COVID-19 and despite knowing that, are they still continuing smoking or quitting smoking? And lastly, what kind of policies should be implemented to address this issue? I want to give a brief overview of these two papers here. The first one was conducted in Bangladesh. A cross-sectional survey was conducted with 164 students at Nandy University in 2015. Data were analyzed using logistic regression model, chi-square test, and feature-exact tests. The overall prevalence of tobacco smoking was 60.2%, where males smoked at a higher rate than females. The influence of friends was the most significant factor or determinant for the tobacco initiation. Now, in this second study, it was conducted in Turkey at Gazi Osman Paşa University in May 2013. Data was obtained through face-to-face questionnaires and tested using the binomial logic regression model. Of the 253 students in the study, 101 were smokers. The smoking habit of parents and friends, income levels, differences in places where they lived positively affected cigarette smoking. If you look at the analysis methodology section, we conducted a cross-sectional study at East University, which is situated in Chattogram in 2021, which is this year. We conducted an online survey because of the present situation. Respondents were informed that the information gathered would be kept confidential and that their involvement was entirely voluntary. Our data were collected through random sampling. Both qualitative and quantitative methods were employed, and it was pretested in a pilot study of 25 students. And following this pretest, we made some minor adjustments to the questionnaire. We divided the questionnaire into 4 sections, where only section 3 was set aside for smokers. Data were analyzed using SS software version 20 and chi-square test. Cross-tabulation was performed to look for any relationship between 2 or more variables using chi-square. The level of significance was p-value less than 0.05. If you take a look at our analysis section, out of 229 respondents, there were 88 female respondents and 141 male respondents, and they were found to be statistically significant. Among 229 respondents, 21.4% were smokers, and where 0.9% were female and 20.5% were male. From the p-value provided in Table 1, we can understand that the statistically significant demographics are gender and age, as the p-values are less than 0.05. This means that gender and age are respectively associated with smoking status. Now, if we take a look at Table 2, the most significant factor that influenced the initiation of tobacco is stress, and another factor was friends' influence. Now, this portion of the survey was conducted structured for only smokers, so 49 out of 229 students answered these questions. Only 5.2% out of 21.4% of students succeeded in quitting. Now, if we take a look at this table, here we can see that 65.9% of the students were exposed to environmental smoke, commonly known as passive smoking. We took a different approach and tried interlinking this with the COVID-19 scenario. And we know that the COVID-19 has undeniably triggered a worldwide public health crisis affecting over 200 countries. When the students were asked if they will continue smoking after the pandemic gets better, their response was in the affirmative. The observations of our study demonstrate that students initiated smoking tobacco around their adolescent years and throughout the university years. Our findings imply that age and gender are the significant determinants associated with smoking tobacco. Smoking at a young age could have been possible due to the ease of availability and affordability of tobacco products in various areas, and also because there are no age limitations. Because Bangladesh is a Muslim majority country, women and girls are culturally and religiously bound, and thus female had limited opportunity to smoke. Our data revealed that there were fewer female smokers than males, and this supports our hypothesis earlier. Stress and friends' influence were the primary drivers of tobacco smoking initiation, with family members of tobacco smokers playing an indirect influence in it. As per our research, the majority of the surveyed students attempted to quit smoking but failed. Because we are in a critical period, they must stop smoking. We have some limitations in our study. We collected cross-sectional data within a small area and a relatively small sample size. The data collected in this study were all self-reported, so this may be prone to bias. Since our sample area and size are relatively small, our findings may not reflect that of other areas of our country. The study was solely based on tobacco smoking. No illegal drug use or tobacco products were mentioned. No other non-tobacco products were mentioned here. The study was limited to one out of all the universities in Chattogram, Bangladesh. This study focused only on university students. It did not involve any school-going or non-students. I had some recommendations that I wanted to introduce. One of them is online anti-smoking commercial campaigns, since we can't conduct an offline campaign. In addition to this, anti-smoking commercials should be implemented. We can do this through using LED TV billboards, besides newspapers, magazines, and televisions. Another method is through pop-ups or ads on social media networks. The government should begin tobacco education in primary school and make it mandatory so that children at a young age can have a basic understanding of it and help the smokers cope with it in the future. The government should also impose age restrictions to reduce the consumption of tobacco smoking by introducing an ID verification while purchasing such products. Bangladesh intends to raise cigarette prices to minimize smoking and enhance tax revenues. It was mentioned in our budget plan for the fiscal year 2021 to 22. It is not solely the government's responsibility to address this issue. We as individuals must also take matters into our own hands and help disseminate anti-smoking awareness. Thank you.